Top 30 Occupational Therapist Interview Questions and Answers. If you are preparing for an occupational therapist interview, you need to demonstrate clinical knowledge, communication skills, empathy, problem-solving ability, and confidence working with patients of different ages and abilities. Interviewers often ask questions about assessment, treatment planning, rehabilitation, teamwork, documentation, and patient-centered care. This guide provides 30 commonly asked occupational therapist interview questions with professional sample answers. Use these answers as preparation, but personalize them with your own clinical experiences, achievements, and examples to make your interview responses authentic, confident, and memorable. Tell me about yourself.
I'm a compassionate and patient-focused occupational therapist with strong knowledge of rehabilitation, functional assessment, and individualized treatment planning. I enjoy helping people regain independence and participate in meaningful daily activities. My strengths include communication, observation, problem-solving, teamwork, and adapting interventions to individual needs. I focus on understanding each patient's goals and abilities before developing practical treatment strategies. I also maintain accurate documentation and continuously improve my clinical knowledge through learning and professional development.
Why did you choose occupational therapy as a career?
I chose occupational therapy because I wanted a healthcare career where I could make a meaningful difference in people's everyday lives. Occupational therapy allows me to help patients improve their independence, confidence, and ability to participate in activities that matter to them. I particularly enjoy developing personalized treatment plans and seeing gradual progress. The profession combines healthcare knowledge, creativity, communication, and problem-solving, which makes it both rewarding and professionally challenging for me.
What are the main responsibilities of an occupational therapist?
An occupational therapist evaluates patients' physical, cognitive, emotional, and functional abilities and identifies challenges affecting daily activities. Responsibilities include conducting assessments, setting measurable goals, developing individualized treatment plans, providing therapeutic interventions, monitoring progress, documenting patient information, educating patients and families, and collaborating with healthcare professionals. Occupational therapists may also recommend adaptive equipment, environmental modifications, and strategies that improve independence. I believe effective therapy should always focus on meaningful activities and the patient's individual goals.
How do you assess a new patient?
I begin by reviewing the patient's medical history, referral information, current concerns, and previous treatment records. I then conduct an appropriate occupational profile and functional assessment to understand strengths, limitations, routines, goals, and environmental factors. I observe the patient's performance during relevant activities and use standardized assessments when appropriate. After collecting information, I discuss findings with the patient and healthcare team, identify priorities, establish measurable goals, and develop an individualized intervention plan based on clinical evidence.
How do you develop an individualized treatment plan?
I develop a treatment plan by combining assessment findings with the patient's personal goals, medical condition, functional limitations, environment, and daily responsibilities. I prioritize activities that are meaningful and relevant to the patient's life. Goals should be realistic, measurable, and time-specific. I select evidence-based interventions and regularly monitor outcomes. If the patient is not progressing as expected, I reassess the situation and modify the treatment plan while communicating important changes with the appropriate healthcare team.
How do you handle a patient who is not motivated?
I first try to understand why the patient is unmotivated rather than assuming they are unwilling to participate. Pain, fear, depression, fatigue, frustration, lack of understanding, or unrealistic expectations may affect motivation. I communicate empathetically and connect therapy activities with meaningful personal goals. I may begin with smaller achievable tasks to create confidence and demonstrate progress. I also involve the patient in decision-making because greater ownership often improves participation, cooperation, and motivation during rehabilitation.
How do you deal with a difficult patient?
I remain calm, respectful, and professional when dealing with difficult patients. My first priority is understanding the reason behind their behavior or frustration. I listen carefully without interrupting, acknowledge their concerns, and explain treatment expectations clearly. If necessary, I adjust my communication style or modify activities to make therapy more comfortable and achievable. I maintain appropriate professional boundaries while ensuring patient safety. If a situation becomes serious, I follow workplace procedures and involve appropriate team members.
How do you measure a patient's progress?
I measure progress using objective observations, standardized assessments when appropriate, functional performance, patient feedback, and achievement of established goals. I compare current performance with baseline findings and document meaningful changes in areas such as independence, strength, coordination, cognition, mobility, or participation. I also consider whether improvements are transferring into real-life activities. Regular progress evaluation helps determine whether interventions should continue, change, or become more challenging. Accurate documentation ensures that progress is communicated effectively.
What is your approach to patient-centered care?
My approach to patient-centered care begins with understanding what matters most to the patient. I consider their goals, preferences, cultural background, lifestyle abilities, environment, and concerns when developing treatment. I involve patients in decisions and explain interventions in language they can understand. Rather than focusing only on a diagnosis, I focus on how the condition affects daily life and meaningful activities. This approach helps build trust, improve engagement, encourage independence, and create more relevant rehabilitation outcomes.
How do you work with other healthcare professionals?
I believe effective teamwork is essential for delivering safe and comprehensive patient care. I communicate regularly with physicians, nurses, physical therapists, speech therapists, social workers, caregivers, and other professionals involved in treatment. I share relevant observations, listen to other perspectives, and respect each professional's role. I participate in team meetings and ensure important changes are documented appropriately. When disagreements occur, I focus on evidence, patient goals, safety, and professional communication rather than personal opinions.
How do you handle a heavy caseload?
I manage a heavy caseload by prioritizing patients according to clinical needs, safety, urgency, scheduled goals, and available resources. I organize my daily schedule carefully and prepare necessary materials before sessions whenever possible. I maintain accurate documentation without unnecessarily delaying other responsibilities. If workload becomes difficult to manage safely, I communicate with my supervisor rather than compromising patient care. Good time management, flexibility, organization, and clear communication help me remain productive while maintaining high standards of care.
What would you do if a patient refused treatment?
If a patient refuses treatment, I would first respect their right to make an informed decision and avoid pressuring them. I would calmly ask about their concerns and determine whether pain, fear, misunderstanding, fatigue, or another issue is contributing to the refusal. I would explain the purpose and potential benefits of therapy clearly and offer reasonable alternatives when possible. I would document the refusal appropriately and communicate relevant information to the healthcare team according to workplace policies.
How do you handle patient confidentiality?
I take patient confidentiality extremely seriously. I only access information necessary for my professional responsibilities and discuss patient details with authorized individuals involved in care. I avoid discussing patients in public areas and follow organizational policies regarding documentation, electronic records, and information sharing. When communicating with family members or caregivers, I confirm that appropriate consent or authorization exists. Protecting confidentiality builds patient trust and demonstrates professionalism, ethical responsibility, and respect for every individual's privacy and dignity.
What occupational therapy interventions do you commonly use?
The interventions I use depend on the patient's diagnosis, functional limitations, goals, and environment. They may include therapeutic activities, functional task training, strengthening, coordination exercises, cognitive activities, sensory strategies, energy conservation, adaptive techniques, and education. I may also recommend assistive devices or environmental modifications when appropriate. I always select interventions based on assessment findings and evidence while considering safety. Most importantly, I connect therapy activities to meaningful daily occupations so patients can apply improvements outside the clinical setting.
How do you educate patients and their families?
I provide education using clear, simple, and practical language appropriate to the patient's understanding. I explain the purpose of therapy, demonstrate techniques when necessary, and encourage patients or caregivers to practice safely. I use teach-back methods to confirm understanding and correct misconceptions. I also provide written instructions when appropriate. Family education is especially important when caregivers support home programs or daily activities. I encourage questions and ensure education respects the patient's preferences, abilities, culture, and independence.
How do you handle an aggressive or angry patient?
I remain calm and avoid responding emotionally. I maintain appropriate personal space, listen carefully, and acknowledge the patient's frustration without accepting unsafe behavior. I try to identify the underlying concern and use clear, respectful communication to reduce tension. Patient and staff safety always come first, so I follow organizational procedures if the situation presents a risk. I involve appropriate colleagues or security resources when necessary and document significant incidents according to workplace requirements.
How do you maintain accurate patient documentation?
I complete documentation promptly, objectively, and accurately after treatment whenever possible. I record relevant assessments, interventions, patient responses, progress toward goals, recommendations, and any significant changes. I avoid vague statements and use clear professional language supported by observations. I follow organizational standards and legal requirements for documentation and protect patient confidentiality. Accurate records support continuity of care, demonstrate clinical reasoning, communicate with other professionals, and provide an important record of the patient's rehabilitation progress.
What would you do if you made a clinical mistake?
If I recognized that I had made a clinical mistake, my first priority would be patient safety. I would immediately assess the situation and take appropriate action within my scope of practice. I would inform the responsible supervisor or healthcare professional according to organizational procedures and document the incident honestly. I would then review what happened, identify contributing factors, and determine how to prevent recurrence. I believe accountability, transparency, learning, and corrective action are essential aspects of professional practice.
How do you manage a patient's pain during therapy?
I monitor the patient's pain before, during, and after activities and communicate regularly about their comfort level. I consider medical information, movement patterns, fatigue, and the patient's feedback when determining appropriate treatment intensity. I may modify positioning, activity duration, repetitions, or therapeutic techniques within my professional scope. If pain is unusual, severe, worsening, or inconsistent with expected responses, I stop or modify the activity and communicate concerns to the appropriate healthcare professional. Patient safety always guides my decisions.
How do you prioritize patient safety?
Patient safety is one of my highest priorities during every assessment and treatment session. I identify potential risks such as falls, improper equipment use, fatigue, cognitive limitations, unsafe environments, and contraindications. I verify that treatment activities are appropriate for the patient's condition and ability level. I provide clear instructions, monitor responses, and modify interventions when necessary. I also follow infection control procedures, organizational policies, and professional standards. If I identify a safety concern, I communicate it immediately and take appropriate action.
How do you handle a patient who is not meeting their goals?
If a patient is not meeting established goals, I do not immediately assume the patient is unsuccessful. I reassess their current abilities, barriers, motivation, environment, medical status, and treatment approach. I review whether the goals remain realistic and meaningful. I may modify interventions, adjust expectations, introduce different strategies, or collaborate with other professionals. I also discuss progress honestly with the patient and encourage achievable improvements. Regular reassessment helps ensure treatment remains appropriate, patient-centered, and clinically effective.
What is your greatest strength as an occupational therapist?
One of my greatest strengths is my ability to combine empathy with practical problem solving. I understand that every patient has different abilities, goals, challenges, and expectations. I listen carefully and then develop realistic strategies that can improve functional independence. I am also organized, patient, adaptable, and comfortable working within a multidisciplinary team. I believe these qualities help me establish trust, communicate effectively, respond to changing circumstances, and provide treatment that remains focused on meaningful patient outcomes.
What is your biggest weakness?
One area I continually work on is avoiding spending too much time refining details when completing tasks. I value accuracy and high-quality patient care, but I have learned that effective time management is equally important in a busy clinical environment. I now prioritize tasks according to urgency and patient needs, use structured documentation habits, and set reasonable time limits. This has helped me become more efficient while maintaining accuracy, professionalism, and the quality of care I provide.
How do you handle stress at work?
I manage workplace stress by staying organized, prioritizing responsibilities, and focusing on the immediate needs of patients. When several demands occur simultaneously, I identify what requires urgent attention and address those responsibilities systematically. I communicate with colleagues when support or clarification is needed rather than allowing problems to build. Outside individual tasks, I maintain healthy professional boundaries and use reflection to learn from challenging situations. Staying calm, organized, flexible, and patient-focused helps me perform effectively under pressure.
How do you stay current with occupational therapy knowledge?
I stay current by regularly reviewing professional resources, clinical guidelines, research, continuing education opportunities, and evidence-based practice materials. I also learn from experienced colleagues and participate in relevant training whenever possible. When considering a new intervention, I evaluate whether it is supported by reliable evidence and appropriate for the individual patient's needs. Continuous learning is important because healthcare practices evolve. I believe professional development improves clinical reasoning, treatment quality, confidence, and ultimately the outcomes achieved by patients.
How would you handle a family member who disagrees with your treatment plan?
I would listen respectfully to the family member's concerns and try to understand why they disagree. I would explain my clinical reasoning clearly and connect recommendations to the patient's assessment findings and goals. I would encourage constructive discussion while maintaining appropriate professional boundaries and patient autonomy. If necessary, I would involve other members of the healthcare team to clarify concerns and develop a shared approach. My goal would be collaboration while keeping patient safety, preferences, rights, and best interests central.
How do you adapt therapy for patients with different abilities?
I adapt therapy by considering each patient's physical, cognitive, sensory, emotional, communication, and functional abilities. I adjust task difficulty, instructions, equipment, environment, pacing, and assistance according to individual needs. I may break complex activities into smaller steps and gradually increase challenge as the patient improves. I also consider fatigue, motivation, cultural preferences, and personal goals. Flexibility is important because the same intervention may work differently for different patients. My objective is safe, meaningful, and achievable participation.
Describe a successful teamwork experience.
In a successful teamwork situation, I focus on communication, shared goals, and respect for each professional's expertise. For example, when caring for a patient with multiple functional limitations, I would communicate relevant occupational therapy findings with the multidisciplinary team and consider recommendations from other professionals. We would coordinate interventions to avoid conflicting approaches and provide consistent education. I believe successful teamwork requires active listening, timely information sharing, flexibility, accountability, and keeping the patient's safety and recovery goals at the center.
Why should we hire you as an occupational therapist?
You should hire me because I bring a patient-centered approach, strong communication skills, clinical responsibility, adaptability, and genuine commitment to helping patients achieve greater independence. I understand the importance of individualized assessment, evidence-based intervention, accurate documentation, teamwork, and patient education. I am willing to learn from experienced colleagues and continuously develop professionally. I also remain calm when facing challenges and focus on practical solutions. I would bring professionalism, compassion, reliability, and a strong commitment to quality patient care.
Where do you see yourself in 5 years?
In 5 years, I see myself as a confident and highly skilled occupational therapist with expanded clinical knowledge and strong experience working with diverse patient populations. I hope to continue developing specialized expertise, completing relevant professional education, and contributing positively to my healthcare team. I would also like to take greater responsibility in patient education, mentoring, quality improvement, or other appropriate professional activities. Most importantly, I want to continue improving patient outcomes while building a long-term and rewarding career in occupational therapy. Preparing for an occupational therapist interview requires more than memorizing answers. You should understand your clinical responsibilities, communicate confidently, demonstrate empathy, and explain how you approach assessment, treatment, teamwork, safety, documentation, and patient-centered care. Use these 30 questions to practice speaking naturally and support your answers with real examples whenever possible. Interviewers want to see how you think and respond to situations, not simply hear rehearsed statements. Stay professional, confident, honest, and focused on helping patients achieve meaningful functional outcomes throughout their rehabilitation journey.